Vision outcomes of endovascular treatment for unruptured ophthalmic artery aneurysms. Via World Neurosurgery. Publication date, August 2018. Source, World Neurosurgery, Volume 116. Authors, Yong Woo Yu, Shik Shim, Whan Lee, Dong Joon Kim, Byung Moon Kim, Yong Cheol, Keun Park, Joonho Chung. Objective. The purpose of this study was to report the author's experience with endovascular treatment, EVT, of ophthalmic artery, OA, aneurysms and to investigate risk factors for visual complications of EVT for unruptured OA aneurysms. Methods. 54 patients with unruptured OA aneurysms subjected to EVT were recruited for this study from March 2010 to December 2017. The clinical and angiographic outcomes of all 54 patients were investigated and analyzed retrospectively. Results. Of the 54 patients included in this study, 5 patients, 9.3%, had visual complications, including asymptomatic unintended occlusion in 2 patients, 3.7%, and symptomatic complications in 3 patients, 5.6%, 2 patients, 3.7%, had transient visual complications, and 1.9%, had a permanent complication. No subacute or delayed visual complications occurred during the 20.8-month follow-up period. OA incorporation by the aneurysm, odds ratio, or 3.471, 95% confidence interval, 1.115 to 9.184, p equals 0.038, and intentional occlusion, or 1.820, 95% 1.248 to 6.221, p equals 0.044, were independent risk factors for visual complications in a multivariate logistic regression analysis. Conclusions. The visual complication rate was 9.3% when performing EVT for unruptured OA aneurysms. OA aneurysms with OA incorporation by the aneurysm might be at higher risk of visual complications when performing EVT. Intentional occlusion should be performed with caution, even though a patient may have favorable collaterals during balloon test occlusion. Add tags, currently, Neurology, Medicine by Alexandros G. Sfakianakis,